My greatest strength as a healthcare provider, I think, is the ability to empathize with my patients, to understand their concerns and their needs, and to relate to their problem. My practice philosophy is to understand the problems that my patients have and to address their concerns, to put myself in their place, how they would feel, recognize their fears, and then help to alleviate that. I think the biggest part is to be the patient advocate. My favorite health tip is, I always tell my patient that we have to grow old gracefully. We all grow old, but we have to maintain the hard work that we do to keep ourselves in good shape. So it's a partnership. We do our job medically to take care of the patients, but on the other hand, the patients have to work to maintain the progress that we've made. The first thing is to listen to what the patient's needs are, and then to go down and address and prioritize what we should attack first. And then as we work through the whole process, answer all the questions that they may have. I have a couple of areas that I'm very interested in. The field of study that most interests me, number one is sudden cardiac death in very young people. You know, when we hear about young people dying, it's very dramatizing because we don't expect young people to die. And so looking at the genetic component of why certain people have certain death is an interest to me. And in my practice, I've had many patients who are young with a genetic defect that may predispose them to early sudden cardiac death. And so we utilize genetic studies to help predict and also help with their families to provide assurance and reduce the risk of sudden death.